Caring for disabled children is a part of the social outreach of Sacred Heart Theological College, Shilllong. The professors and students here are greatly involved in several social outreach programs on a regular basis among the young and children most in need. Every Sunday and on days when time can be made available, all the resident students of the college and some professors move into villages near and far to listen, understand, to affirm the young for whatever is positive in them, and to be a part of the solution wherever needed. Caring for the disabled children is one such initiative.
We started this project in 1989. I saw many children going around with crooked legs, with 3-4 types of deformities, either completely bow legs this way, or they would have knock knees, or they would be having a deformity of this sort. And the deformity is not only in the hands, in the feet, but it is also in the hands and also in the rest of the bone structure. We wondered what could be done. Then speaking to an orthopedician, he told us that some improvement can take place if we treat them with a calcium therapy. So we went in for that, starting with concentrate of calcium initially, and then smaller doses of calcium after that. And we found that things started improving very greatly. And the very children who did not want to come in the beginning, they and their parents were eager to bring their children after that for these treatments. And then following this conservative treatment of medicines to be taken by mouth, medicines to be applied on the body, exposure to sunshine and all this, children started getting much better. And this very bad deformities also started getting, not only improving, but getting healed. Of course, it varied from child to child and case to case. Some children who were at the early stages of this Ricket's problem, they got well very fast, in a month's time sometimes, in a few months' time in other cases. But sometimes also it took 2 years, 3 years for the deformity to be more or less completely cured. But the beautiful part of it is that there is no child that doesn't get well. If the child, with the help of the parents, is regular with the medicines, with the treatment, we find that there is complete cure and complete healing for this. And in this way we've been able to help thousands of children in the course of these 25 years. Thousands of children not only here in Shillong, but children from distant villages like Maukarwad, Mairang, Nongstoin, even from some other states. From Assam they were coming here asking for help. We have people who came from Dimapur, we have people who came from Tripura and places like that. And that is something beautiful about it. The news has gone around that there is treatment, there is cure available. And also some social workers and others came and consulted us about our experience, and they've been able to translate this experience in their own places. We have monthly medical camp every first Sunday of the month. Usually we have a camp here in Sacred Heart College. Yesterday, the 1st of June 2014, and we had, believe it or not, 109 new cases after all these years of treatment and conscientization and all that. There are still so many people around us with this problem. And 355 old cases that came to meet the doctor again to take medicines, just to say. In this way we have in different villages, some of them come, some of them do not come. Unfortunately, this problem can be solved only up to the age of 11, 12, maximum 13. After that, once the bones are hardened, we can do nothing. If it is early stages, early years, 1 year, 1.5 years, 2 years, the healing is very fast. And the medicines take effect very fast, really.
Kuat ni lah. Betul. Ni. Langkah ini hikti ni wilayah. Baik ini isian dia. Makia mana? Perang siap. Kimlang tengah. Hijab. Betul. Begitu. Jadi apa? Langkah ini kita tu ini malah kedua ni. Ini yang baik. Ini kalau tengkuk. Ni memang tengkuk ni. Lah tengkuk ni hak siap. Ini sini ni. Lah kon ni.
So we are trying through volunteers, through social workers to visit the houses, to visit the villages, and also to get conscientized people about the need of doing something quickly once they have been affected.
Ngaku aban kerja pilih dia cepat kali ke jimpang ke ba iwan hangi mentah ni ai dawai mo kali ke jimpang ke bagi orang ke jimpang jam siang. Kali ke jimpang hang ke jing sisa kamdai ke ba la penlong dau yang jimpang ndai bagi yo anak dau yang jimpang ndai nak dau ke jingna ke bang akamet. Tidon ke tu ni ki kena ki ba haji sisa ni ka tu ni bun ki kena ki ba khamtam se ki jaga support nang dong ki babam tang da kaja baruhan unsin ni kini gili jimang ki bang step masing ki step ru ki lahi da shasau ki bang kaja kemen siru ki bang kaja baruhan nang tajan miet ka shasau biang bat kaja tenda miet ru kaja biang baruhan tiga ni ke jimbang ka syuru be tang hak po la biang tiga jimbang ki balik sipo ki sien si thiet ki jaw undan namar ba kimdan ki tiga jimbang ki badai nak ta kini dia kecil sisa tadi kecil pang kadai kamtam baduna kalsium kamet bangdan dengan kalsium tadi kecil pang kabaki bang kamdan kalsium dia nak kata kadau kecil pang kabakongsan hi kabaki deban bang kideban sufu ke bani deban bang kadon ka bang ni pori jumi ka bandre lo kim tip sam ka ka bang kabaki deban bang dia hangni na kwa kan batai bikin dia kan ke kata ka bang kabaki deban bang ni nat na ni kecil pang kecil sto kebakongsan kadai kadut kadai kabandingkong kabandi di bandi wat ki kelumru bun sin kimyo do kiyo da kasya sam ki dai baha bandi kadut nang ta bade ha kapeleng ni dai ban bam nang ta ki kenja jur baro ni dai ban bam nang ta bade ki kasyriu ko kabon mo kalsyum nang ta la syam baha uni li ubang ni julang hamni apori kasiju bun Nili ru ubabur bahaka kalsium bagi nak bagi bam. Tikini kita gijing bam ki bang ham kongsan ken ki badai nak benta tani gijing jam si. Tan reh bajuk ko por kini ki bawan sim nawai ni kim sim don tak kani gijing bam jam si. Ndai ki duna ru ki wei pat ki bam. Ki duna ka bagi ong ka protein namar bakim ju khamba me ki shana ya dai ya kini ki rambaija dia nak kata kadang ki don ru kata gijing ni om kajing duna ka protein ti kidai ban ba me kini gijing bam ru khanang bakin long ki bakoi bakhya na dong sedong baka met ka pha chung ki kan biang kai kinum dan kan ka jing jam sien ka jing kodor ka jing ya kan riang jung ki sien bat kinum dan kan ka jing atang ka kho bandre ki kiti ki kajak dala de ki ba me kini gijing bam kinum lele ki la bakin koi bakin khia dia baju ko pora kani kali ke jongi ni siam kamtam ni ka si juni ni siam ba ki jaka ki bas ko no kondom ni lai bun sin ka ha ka portalam ka khliat nanta ha ka por slap pa de ki ji ki pen sop ye ki na khli ka ja de ki kajak sni ru kim yo ke man sha ka ki ti kajak chung ki ka met ka ha chung ki dan bre ha kajak sni ru ka dan ke jimbang ka de na ka ka ji jam si de ha bangi yo ala ni de ban pun phogi ki sop ti ka balan kot patran balan kot penya ye ki bum tu musi pang ko kasni nan bakasni itu ka jimbang ko badan kasni kan la bakan kita ya ki ya kamet ka pa chung ki bakin yo to jimbang bakin like ni ka jimbang jamshi.
We have also been helped for medicines by a number of good people who have paid the cost of medicines, who have paid the cost of injections, who have paid the cost of the syringes, who are also helping us in our little educational projects. We have a school, an afternoon school for poor children who cannot go to other schools because of their family situation.
caring literacy program di sekolah nama tajuk beduk. Bila sedang dia caring literacy program, hausnya ahajar lain. Jing sedang jangan di sekolah ni dan dikena pun satu di nama lain. Ini kita dikena di beduk, kita kena berpesan sekolah ini kita yang tajuk ini. Tinggi kau ini kena bikin one school, duduk kelas A, duduk kelas 1. Andai kata kelas 1 hak yang diki sebut Saint Aloysius School, kemudian nak masa duduk kelas 2, duduk kelas 10.
Kau ni syah yang dua yang play track and rap, pula play ni kalau aktiviti. Kau juru ikan hikai kalau kita tu sedang merawat ini, kena menjawab di sekolah. Lagi syah menjawab di sekolah nama dia kerja. Berpun kita kita ngai mak kita juga kena mission.
And one of the reasons why we are calling these children together is not only for the education but also to give them some milk and bread and things like that, which will give them enough nourishment so that we can prevent the recurrence of or the worsening of rickets and other related problems that these children are suffering from. I must acknowledge and thank with all my heart the many doctors, the many nurses, the many volunteers who help us, and also those good people from India and from Italy and from Germany who have been helping us very generously all through these years with their financial contribution so that we can buy medicines for these children. In all these years, what are your impressions about this Rickets program?
Well, I find it's very, very helpful, especially to the needy people who cannot afford to go for to expensive treatment and all. So this is a very nice program.
From your experience, is it only because of a diet problem or is it some other reason for this rickets?
Yes, the first and foremost thing is diet problem. Then the second thing is about, this is hereditary, what we have found from here. Hereditary from the mother to the child.
Cái này ông quan là đủ nhà mặt chặt ra để mình chưa là làm lạ cái mình lên quất lên biscuit mình chủ lạ mình lên quất ta phải lạ mình lên quất là làm khanh cái bột lên xuống cá làm cho mình rạ này cái nốt rồi đi mua la rồi làm lạ ra mình đặt lạ nó lạ mình rạ đang tiền.
Are you happy that you have been associated with this program?
I'm very, very happy because as it is, I myself am a victim of rickets.
You've been associated with this program since 1989, if I'm not mistaken. I feel so happy that you were with this program right from the beginning and you are still there. I just wanted to ask you, what are your impressions about this Rickets program?
My impression of the Rickets program is, it's quite a big job. It's quite a big, achievement that we are able to help these children who are suffering from this disease. Previous father with very little children, at that time people they don't know much about this disease. So we started with some of the neighborhood children only because in the other areas they don't know. So with the years, I've seen it increasing so much. The news of this Sacred Heart Ricket program has, spread nearly throughout all our eastern states. So that is a great, very great achievement.
As a doctor, what would you suggest to improve this work?
As a doctor, to improve this work further, I think we need more of health education programs. because this disease is mostly because of ignorance.
Do you find that the number of cases of rickets are decreasing or are they increasing?
That further we may see it is increasing.
Kaumshimti, since which year are you coming to help in this program?
2004 or 5.
Do you think that these injections are extra beneficial more than the other medicines?
Yes, because medicine, it takes more time for them to get cured. An injection, it will take faster. Means instead of taking for 2 years, maybe they will reduce by 6 months.
With all my heart, I would like to say thank you to all these persons, to all of you who are listening to me now, for this very kind help that you have been giving. It is not to me this help comes, it is to these children and their families, and in this way you are doing such a wonderful service for these poor and suffering children. And surely God will bless you for this great, generous service that you are doing, you continue to do. I would only ask you, please continue to help us so that we can help more people in this particular way. Without you, we would not be able to do the good that we are trying to do. But with you, with your cooperation, with your presence, with your financial assistance also, we would be able to reach out to many more. And the need is great. But the resources, the human and the financial resources are very low, and that is why if you can help us, we will be able to reach out and help many more people. We would also like to do something more about conscientizing people to prevent this problem. That there is enough nutrition, that children from early stages onwards, beginning with the mothers themselves, beginning with the parents themselves, and then the children would get proper nutrition so that these rickets and related problems can be prevented. That's what we would like to do. But that again would need a lot of collaboration from you all, and I would very kindly request you, please continue to help us, continue to sustain this work, and thank you again for all the good that you do.